you pointed out one of the interesting statistics, the bottom line, overall healthcare spending as a percentage of GDP, and the fact that it's roughly about the same now as it was in 2019, which is an interesting, a relevant sort of comparison to try to look through all of the ups and downs of the COVID years. When the same group looks ahead, um, they forecast spending to go up rather rapidly as a percentage of GDP to close to 20% in over 10 years. I wonder why that is. I mean, you're looking, backwards, and healthcare spending as a percentage of the economy really hasn't grown as fast as we thought it would. And by the way, when we were looking at these numbers, you and I at the Concord Coalition years ago, we would have thought it would probably be well over 20% of GDP by now, and it hasn't had that rapid growth. But the folks who analyze this from CMS uh, do project it's going to pick up growth again. What's behind that projection?
I think there are two things behind that projection. One is that the longer lens of history is that in the United States, healthcare costs grow faster than the economy. So all of the models that are built to project future healthcare spending still look back far enough where we had this growth that was rapid relative to GDP for our healthcare spending. So I think that's one part of it, that there is still this notion that we're going to return to trend where healthcare spending will grow faster than the economy. I think the other part of that is that there hasn't been any major reforms or changes to the American healthcare system over the last decade that suggest we had solved the issue of healthcare cost growth. And so that is the other reason, I think, why there's this assumption that healthcare costs are going to grow faster than the economy. But I mean, when I teach and give speeches, it is really important to point out that since 2010, we have really not had healthcare growing faster than the economy, and that is the first kind of decade or more of that phenomenon since we basically invented modern medicine and modern social insurance. So it's like since the 1960s. So it really has been the last 15 years a really kind of amazing change. And I think that we haven't wrapped our heads around that enough as healthcare researchers, but also kind of the healthcare system and the politics around healthcare haven't changed in relation to that slower of growth of healthcare costs. And I mean, this is kind of a separate issue, but one of the reasons that is that for average Americans, their sense of healthcare costs has not slowed down relative to the economy, because our deductibles and our cost sharing on an individual basis has been growing faster than inflation, and really faster than wage growth, which is kind of our individual experience with a growing economy. So even though in the aggregate we have had this remarkable slowdown in the growth of healthcare costs, as individuals, we haven't felt that slowdown, which is why there is still political pressure, and I think good political pressure to force policymakers to keep thinking about how to lower healthcare costs. And that should be done not just thinking about my individual experience with healthcare costs, but really our national experience with healthcare costs. We still need to get those costs to slow down because, again, we're spending so much money, much more than any other developed country. And we do have this projection that I think we need to take seriously, that healthcare costs will grow faster than the economy over the long term.